I'm Beth Wagner. Welcome back to my channel focused on movement and function. This video is for you if you completed my back pain mini self-exam video and found that your back felt better doing extension movements, either doing the repeated extension while lying on your stomach or doing the extension movement standing up. First, I'll talk briefly about what we're looking for in terms of symptom response, and then I'll show you the exercises. If you have pain, numbness, tingling, or weakness running down your leg, we want to see those symptoms move up out of your leg, back toward your spine, and ultimately right to the middle of your spine. If you only have midline back pain, we want to see the pain decrease in intensity. This symptom response is what you want to look for every time you do the exercises, and it will get better and better as you go along with this program. The backbone of your program is extension, and most people do best with the press up lying on their stomach. I'll show you that now. You can do this exercise lying on your bed or the floor or anywhere where you feel comfortable lying on your stomach. You'll start with your hands palms down right next to your shoulder. Press up, pause, and then lower. I recommend doing 10 repetitions every 1 to 2 hours. If this feels good for your back, but the pain returns between sessions, you might need to do this more frequently. Let pain be your guide. If it feels good, do it more often. Let me show you a couple of tweaks with this exercise. First of all, if you have pain along one side or the other, you might benefit from doing this exercise with your hips off center. If the pain is on my left side, I'm going to move my shoulders over toward the left side and then do the press up just as you would normally do it. As soon as you get relief doing the press up in midline without your hips off center, continue doing it that way. Another tweak is to add overpressure to the movement. When you get up to the top of the movement, exhale and let your belly sag. This will add just a little bit more pressure and possibly more relief for you. And return to the starting position. Another option is to hold the top position. Press up, let your belly sag, and then hold for 3 to 5 seconds. And then lower back down. Another option is to hang out on your stomach, propped up on your elbows. This can be very helpful if you're reading a book, checking your phone, even watching a movie or something. Hold this position for anywhere from 5 minutes to 15 or 20 minutes. Listen to your body and respond based on how it's feeling. If it's difficult for you during the course of your day to find time to lie down every 1 to 2 hours, try doing standing extension. With this exercise, place your hands on your hips on the side or your fists at the top of your hips in the back, whichever is most comfortable for you. Feet comfortable distance apart, and then bend back and come back up. Again, 10 repetitions every 1 to 2 hours. The best way to add overpressure to this exercise is to stand against a countertop that comes up to the top of your hips. Then lean back against that countertop. This table is a little bit low for me, but you'll be able to get the idea. Using my hands for support, feet comfortable distance apart, I would bend backward over the edge of the countertop. As your symptoms improve, you can decrease the frequency of your exercises to about 2 times a day. See how that feels. If your pain starts to get worse again, you'll need to do the exercises more often. For maintenance, I recommend continuing to do these exercises at least once a day, ideally twice a day, in the morning and in the evening. That can be a great way to prevent relapse of pain down the road. Another exercise that can be very helpful to support your overall program is a hip flexor stretch. Find a wall or a countertop for support. Step 1 foot back, bend the front knee, and perform a small lunge while keeping your posture upright. You should feel a stretch in the front of your hip here. Hold this position for 20 to 30 seconds and do it 3 times on each leg. Do that exercise 1 to 2 times a day. In terms of activity, I recommend things that involve upright posture that maintain the natural arch in your back. Things like treadmill walking, walking outside, and swimming are typically the best exercise options for you. Right now, I would avoid cycling, either outdoor cycling or on a recumbent bike. I would also avoid doing sit-ups. Down the road, improving your core strength can be a very important component to preventing back pain. However, in the midst of an active bout of back pain, typically trying to do core exercises, especially sit-ups, too soon just ends up aggravating your back. So wait on the core exercises for now. Focus on these exercises that you're starting in this video until your back pain is gone or significantly better. In terms of rest position, I strongly recommend avoiding sitting slouched. Try using some support pillows behind your low back so that your posture is still upright and you're maintaining the natural arch in your back while still relaxing into the seat. Play with that a bit. Try some different pillows and different supports to find a position that's comfortable for you that doesn't aggravate your back. I hope the exercises in this video are helpful for you to reduce your back pain and get you back to doing the things that you love to do. Please subscribe if you haven't already done so, and it's always great to see a thumbs up. Click the bell next to the subscribe button if you'd like to be notified when I release my next video. Here's to your healing, health, and happiness. Have a great day.